Hey guys, so today we'll be discussing about brainstem syndromes. We've got a couple of brain stem syndromes. The first one being lateral medullary syndrome, better known as Wallenberg syndrome. So in Wallenberg syndrome, there is ipsilateral facial pain or temperature loss, ataxia, dysphagia, hoarseness, contralateral pain and temperature loss in body. So ipsilateral facial pain and temperature loss and contralateral facial pain and temperature loss in body, whereas ipsilateral will get ataxia, dysphagia and hoarseness as well. Cause is pica infarction, posterior inferior cerebellar artery infarction. So I've managed to get you a small mnemonic here. So you remember it as a pirate's pica makes him hoarse, tipsy and numb on one side of the face and opposite side of his body. So you can make hoarseness, tipsy, that is ataxia and numbness on one side of the face, and opposite side of the body there is numbness, that is pain and temperature loss. Alright, I hope you will get that right. Coming to the second syndrome, that is medial medullary syndrome, wherein we have ipsilateral tongue deviation, which is due to hypoglossal nerve involvement, and contralateral weakness, loss of vibration or proprioception. Cause is anterior spinal artery infarction. So the mnemonic for medial medullary syndrome is a tongue-tied wizard mediates losing balance, that is proprioception, and power on one side. So a tongue-tied wizard, that is indicating there is tongue deviation due to hypoglossal nerve involvement, and losing balance and power on one side. Okay, coming to the next syndrome, that is Weber syndrome, where there is ipsilateral oculomotor nerve palsy and contralateral hemiparesis, and the cause is midbrain infarction, or because the branches of posterior cerebellar artery are involved. So the mnemonic here is a one-eyed man named Weber loses his vision, that is indicating oculomotor palsy and strength, hemiparesis. Coming to the next syndrome, that is Benedict syndrome, where there is ipsilateral oculomotor palsy like Weber syndrome, and then there is contralateral ataxia and tremor due to red nucleus involvement, and the cause is posterior cerebellar artery or paramedian midbrain infarction. So the mnemonic here is Benedict waves tremulously while closing one eye. Coming to the next syndrome, that is Millard-Gubler syndrome, where there is ipsilateral facial nerve palsy and contralateral hemiparesis. Cause is spontaneous stroke. Coming to the sixth syndrome, that is Fowell syndrome, where there is ipsilateral horizontal gaze palsy and facial weakness, and contralateral hemiparesis. So in most of the syndromes, the contralateral part is hemiparesis in brainstem syndrome. So ipsilateral, you need to keep a check. That is in Fowell syndrome, we have horizontal gaze palsy and facial weakness. It's due to pontine infarction again. So the mnemonic here is Fowell gazes horizontally at a battle but only moves half his body. Coming to the last syndrome, that is locked in syndrome, wherein there is quadriplegia, horizontal gaze palsy, preserved condition is only vertical movements and consciousness. So in this one, basilar artery occlusion is the reason. So the mnemonic for this one is a prisoner is locked in a tower, unable to move except to look up. So the vertical gaze is preserved, horizontal gaze palsy and quadriplegia are there, and then consciousness is preserved. So thank you.